name is Dr. Tom Brannigan. Today I'd like to do an exam of your arms, if that's okay.
Sure.
What's your name?
I'm Luke.
Luke, nice to meet you, Luke.
Hiya.
Could I get you to take off your top there, please?
Slip that off.
That's great. So I'm just going to stand at the end of the bed and just have a look around, if that's all right.
Sure.
First, remember the general observations that apply to any system. Apply these specifically to the neurological exams. Additional observations that are specific to the neurological examination can be summarized with the mnemonic CASHIER. C is for consciousness level. Is it normal or reduced? Use the Glasgow Coma Scale to report consciousness in a consistent way. A is for asymmetry. Look for symmetry of posture, facial muscles, any spasticity and muscle wasting. A patient can be symmetrically affected, so the presence of symmetry does not outrule any problems. S is for scars. Look particularly for neurosurgical and traumatic scars, but mention any that are visible. H is for hearing aids. I is for involuntary movements. E is for equipment, such as mobility aids, wheelchairs, and assistive devices. R is for a rash. Comment on any visible rashes. Okay, so for the first part of the exam I have to take your hand and your arms and move them around. Have you got any pain in your shoulders, your arms or anything?
No, nothing at the moment.
Okay, so can I just take your hand? Tone is passive resistant to movement. Take the patient's hand as if shaking it. Tell them to relax their arm fully. Now move their hand, forearm and upper arm passively through the range of motion of the joints, including pronation and supination. Compare the left and right limbs. Alright. For the next movement I'm going to test the power in your arms. So can I get you to stick your arms out like this, kind of like a chicken? Sure. Now I'm going to push down, so you just resist me pushing down. Power is tested for using a series of resisted movements. It is important at each step to know which muscle groups are being tested for and their nerve roots. Ask the patient to resist your efforts to move their arms. The test is more sensitive if one arm is tested at a time. However, in practice, both arms are tested simultaneously for brevity. And resist me pushing down, and resist me pushing up, resist me pushing up. Okay, now can you take my fingers in your hands and don't let me pull away? Okay, I'm going to take this piece of paper. If you can grip it between your fingers like I'm doing, and don't let me pull away. Okay, and then the next one. Don't let me pull away. And then the next one. Don't let me pull away. And then we'll do it on the other hand. Don't let me pull away. And the next one. Don't let me pull away. And the next one. Don't let me pull away. That's fine. Can you splay your fingers out like this? And then resist me pushing against them. Great. And finally, with this hand, can you form a circle with your thumb and your index finger? And don't let me pull through. Now change fingers. Don't let me pull through. Change fingers. Don't let me pull through. Change fingers. Don't let me pull through. And then we'll do the same with that hand. So thumb and index, change. And the next one, don't let me pull through. And change fingers. Okay, that's perfect. So the next thing I'm going to do is check your reflexes. There are 3 reflexes in the upper limb. Ensure that the limb being tested is fully relaxed before attempting to elicit reflexes. Some patients may need to be told multiple times before they relax fully. The 3 reflexes of the upper limb are the biceps, the triceps, and the brachioradialis reflexes. When checking the biceps reflex, observe the biceps muscle for a flicker of movement. When checking the triceps reflex, observe the triceps muscle for a flicker of movement. If you are still unable to elicit the reflex, employ a reinforcement maneuver and try one more time. Report your findings at the end of this. When checking the brachioradialis reflex, observe the brachioradialis muscle for a flicker of movement. Okay. If you have difficulty eliciting a reflex, ensure that the patient is fully relaxed, reposition yourself and try again. Okay. Alright, so the next thing we're going to check is your coordination. Alright, so for this, I'll get you to, we'll start with this hand. So touch your nose with your index finger, and then bring it out and touch. Stand facing the patient and hold your finger at the limit of their reach. Move your finger between each touch. Repeat the process 4 to 5 times with the patient's eye open, and then once with the eyes closed. Intention tremor is when the patient develops a tremor as their finger approaches your finger. Pass pointing is when the patient's finger misses your finger and moves beyond it. They will often immediately correct the error using their vision and touch to move their finger back to yours. Test one hand and then the other. Ipsilateral cerebellar lesions are responsible for these signs. Right, that's fine. Okay, so the next thing is using this hand, try and slap it onto the back of this hand onto the panel. Next, test for the ability to perform rapid alternating movements. Together and then just go back and forth. Failure to do this is called dysdiadochokinesis, which is a sign of ipsilateral cerebellar disease. Okay, that's perfect. That's great. And I'll get you to put your arms out like this now. Next, test for rebound. And I'm going to get you to close your eyes and start bringing your arms up like this, okay? And I'm going to say stop at some point. So start bringing your arms up. If there is a delay in stopping the arms, it may be due to hypotonia. Okay, I'm going to check your sensation now. So look, now I'd like to check the sensation in your arms. So you've got your hands down like that. I'm going to check two different types of sensation, light sensation and sharp. The first, I'm going to do both with a cotton bud. So just so you know what it feels like, I'm just going to touch this off here. Did you feel that?
I did, yeah.
And how did it feel to you?
It just felt soft.
Okay. So for this, I'll get you to close your eyes. I'm going to touch this around your arms on the left and right. And I want you to say yes when you feel the cotton bud touching you. And then also let me know if you notice the left feels different to the right. Okay, so close your eyes there. Yes. Test for light sensation of each dermatome bilaterally.
Yes.
After every 2 to 3 dermatomes, ask again if the left and the right feel the same. Yes. If sensory loss is detected, spend more time around that dermatome to define its borders.
Yes. Yes.
Temperature testing is a more sensitive test of the spinothalamic pathway, but in practice it is only done in special circumstances. Okay, and did the left and the right feel the same?
They did.
They did. Great. So now I'm going to use the other end of the cotton bud. It's slightly sharper, just so you know what it feels like. I'll just touch it off there. Did you feel that?
I did, yeah.
And how did it feel?
Yeah, it felt sharp.
Sharp. Okay. So I'll get you to close your eyes again, and I'll go through the same spots again, and just say yes, and let me know if it feels different on the left and the right. Test for sharp sensation of each dermatome bilaterally.
Yes.
After every 2 to 3 dermatomes, ask again if the left and the right feel the same. If sensory loss is detected, spend more time around that dermatome to define its borders.
It was, yes.
Okay, here you go.
Yes. 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 Yes.
Test for vibration sensation using a 128 Hz tuning fork. I'm going to check your ability to feel vibration now using this tuning fork. This is what you're going to feel. Can you feel that?
I can.
And can you feel that it stopped?
I can.
Okay, so you can feel when it's vibrating, when it stops. So I'll do the same on your fingers then. Okay, I guess you close your eyes. After testing for vibration sensation at the sternum, place the vibrating tuning fork on the bone of one of the distal interphalangeal joints.
Stopped.
Okay, I'll just do it on the other side now. If the patient does not feel the vibration, move to a more proximal bony prominence, such as the proximal interphalangeal joint, the ulnar head, or the olecranon process. Okay, so the final test then is just if you can tell where your limbs are in space, a thing called proprioception. So I get you to hold that hand up like this, and I'm just going to take this finger and I'm going to move it up and down. Okay, and I want you to tell me with your eyes closed whether it's up or down. Okay, so close your eyes.
Up. Up. Down. Up.
Okay, and I will do the same if you raise that. Hold the side of the finger and move it up and down, asking the patient to tell you whether you stop with it pointing upwards or downwards. Test for proprioception on the right and the left side.
Down. Up. Up. Down.
Down. Okay, so that's everything. Thanks very much.
Thank you, doctor.
Okay, bye now.